Good evening, everyone. Welcome to this evening's program. You are in for a treat, and we are just about to get started. About 10 more seconds. If anyone else is coming in the room, give them a chance to connect their audio, get situated, come into this moment. All right, we'll get started. So good evening. I am Dr. Kristen Ball-Motley, a pharmacist and president of Healthcare Solutions of Delaware Valley. I was born and raised in Chester, PA, and I will be the moderator for this very important topic for our community, from hurt to peace, complex feelings, difficult decisions, and the COVID-19 vaccine. I'd like to recognize our sponsors and supporters and partners this evening: the Chester Housing Authority, the Foundation for Delaware County, and the J. Lewis Crozier Library. Thank you. Before I introduce our guest, I'd like to acknowledge a great man who we lost today. Secretary of State Colin Powell died today due to complications of the COVID-19 disease. We honor him and we thank him for his decades of service to our country. Next, I'd like to introduce this evening's esteemed panel. Dr. June Elcock-Messam. She's a pediatrician. She's also a board certified trauma specialist and president of Media Pediatrics, where she never shut down her office through this entire pandemic, and she continues to care for patients and strongly advocates for the COVID vaccines. Dr. Kathleen Walls, she is a clinical psychologist and owner of the greatest counseling and consulting firm based in Philadelphia. In addition to being a trauma specialist and diversity, equity, and inclusion consultant, she assisted in the development of COVID-19 vaccine bulletin boards, social media ads, and radio ad announcements for the Virginia Department of Health. Dr. Christopher Hannum. He is the medical director of Compassionate Care Hospice in Media, Pennsylvania. He has been helping on various COVID-19 testing and vaccine initiatives in and around the Chester community. Dr. George James, Chief Innovation Officer and licensed marriage and family therapist at the Council for Relationships. In addition, he is an assistant professor for the Couple and Family Therapy Program at Thomas Jefferson University. In his practice, he helps clients with their anxiety about getting COVID-19, getting vaccinated, and interacting with people like coworkers and families and friends who are on the opposite side of what they believe regarding vaccination. Dr. William King will be joining us. He is a pediatrician at Pediatric and Adolescent Medicine Centers of Philadelphia. He is also the vice president of the Medical Society of Eastern Pennsylvania. Dr. King has been presenting scientific information on the COVID-19 virus, vaccines, and helping communities of color navigate this devastating pandemic. He advises the Chester Upland School District on best practices to help students sustain in-person learning during this pandemic. So, what brings us here this evening? Well, we're here because we're in the middle of a pandemic. Thankfully, scientists were able to develop a life-saving vaccine. However, as we all know, everyone is not on board with getting the vaccine, and that's why we are here. As Black people in America, people have dealt with racism, they've dealt with bias and unfair treatment just from our healthcare professionals, from the healthcare systems, from the hospitals, from the healthcare providers who we see. Because of that, they don't trust the medical community, they don't trust the government, they have concerns, they are not interested in getting vaccinated, at least at this time. However, their emotions and their feelings, they just cannot be ignored. And so we like to have a discussion this evening to help people get through this so that they can um, get through how they feel, not to ignore it, but help them to make the best decisions for themselves and for their families. Because a lot of these people who are not being vaccinated, they have children who they'll have to make a decision for as well. So I like to start our conversation by just checking in on COVID, the COVID climate, and I'd like to ask Dr. Hannum, where are we with COVID cases and deaths?
Well, thank you very much, Dr. Motley. And thank you to all the sponsors and partners for this initiative. And I appreciate the invitation to participate. I wish I could come on and say that COVID-19 pandemic is on the wane and that the numbers are decreasing and that the risk to the community is decreasing. Unfortunately, that's not the case. And over the last 20 months, we've had multiple waves of the infection, the COVID-19 infection. And right now, we're in the fourth wave of the COVID-19 infection. Mm. And this is caused primarily by the so-called Delta variant of the COVID-19 virus. And as you know, there have been multiple variants over this period of time. And it seems that the Delta variant is the most dangerous and the most lethal of the various COVID-19 variants that we've seen over this period of time. So to look at the numbers, in particular, if we want to look at Delaware County, where many of our viewers and our participants tonight live in Delaware County. Over this pandemic, Delaware County has had about 61,000 documented COVID-19 infections. And unfortunately, there have been about 1,500 confirmed COVID-19 related deaths in Delaware County. And those numbers continue. On the average, there are about 2 deaths each day in Delaware County related to COVID-19 infection at this time. And the incidence rate for new COVID-19 infections in Delaware County is over 100 new confirmed cases per 100,000 residents in the county. And actually in the city of Chester, it's as high as 124 new cases per 100,000 residents. Once you get above that threshold of 100, it's considered a very high risk, a very contagious situation. And we also look at the positivity rate. The positivity rate, if 100 people are tested for the COVID-19 virus through the nasal swab test, how many out of 100 will confirm to be positive? And again, if that number is above 5%, that's considered a critical situation. And unfortunately, in the city of Chester, in the month of October, it's been closer to 15% positivity rate. Overall, the city of Chester has about 35,000 or 35,500 residents. Overall, we've had about 4,000 confirmed cases of COVID-19 in Chester.
Mm.
And unfortunately, about 150 residents of Chester have passed away over the last 20 months from COVID-19. So, and we have heard of the numbers on the national level, regarding the whole country. We recently passed a milestone where over 700,000 individuals have perished from COVID-19. In fact, that number is up to about 724,000 individuals who were lost. And it's likely by the end of this year that we'll surpass the 800,000 fatality mark in this country. So the pandemic is ongoing. We're in the fourth wave, and it's critical that those who are eligible, to get the COVID-19 vaccine do so sooner rather than later. We do have the Pfizer COVID-19 vaccine, which was recently fully authorized by the FDA. And the Moderna vaccine and the Johnson & Johnson vaccine, their groups have submitted data to the FDA to get that full final FDA approval, which will probably come in the next month or so. And as far as full disclosure, I just wanted to let everyone know that I'm a big proponent of the vaccines. I did receive 2 of the Pfizer vaccine, 2 doses back in January, and today, literally about 2 hours ago, I received my 3rd dose of the Pfizer vaccine, and I also received the flu vaccine in the other arm. Mm-hmm. So it is okay to get both of those vaccines on the same day, and I encourage everyone to not forget about the flu vaccine as well. So I'll just leave it there, and I'll be glad to answer questions a little later. Okay.
Thank you so much, Dr. Hannum. I appreciate that. So it sounds like we have had the vaccine for almost a year now, and we are not even close to being out of the woods yet. Sounds like we have some ways to go. And I want to ask Dr. King, where are we with the vaccines in terms of the rate in children age 12 to 17? Do we have any data on that?
The rate of vaccination or the rate of infection? Well, so
vaccination rate.
Right. Well, in the city of Chester, it's probably 18% among children who are eligible, which means 12 and up. Mm-hmm. And I work with Chester Upland School District, and so some of the schools, it can be as much as 20% of the kids who are eligible who've been vaccinated. Okay. But unfortunately, that is there's always the Chester. One thing that I would say is that this pandemic has hit the whole country, the United States in particular. Pennsylvania has done as well or better than most states, and because we're in the United States, that means we've done terribly. The United States is by far suffered the most negative outcome of not any industrialized country, any country. We have the most confirmed deaths. We had the most extended duration. We have the most ongoing deaths. Japan is in a panic because they have 40 deaths in a month. Wow. We have towns that have 40 deaths in a month. And there's many, nations in Africa, unvaccinated, who have fewer deaths in their whole country than we do in individual counties. And they they don't have access to the vaccine. Burundi just got something like a few hundred thousand. You know, they finally got a few 100,000 doses for the whole country of, you know, tens of millions of people. And we're begging people to get vaccines that we have. We have 300 million doses in excess right now, sitting around waiting for Americans to take. So I'm with Dr. Hannum. I was at a press conference where they were doing a vaccine clinic. I was trying to get my booster, and then they said, "Oh, Dr. King, can you come? You know, the governor's coming. Everybody get in line." I was like, "Oh man, I'm gonna miss my shot." So,
Almost.
so I got to go to Rite Aid to go get my shot this week. But
Wow.
you know, I'm happy to go to Rite Aid because you know, I have to say that kids are unvaccinated mainly because they're in households where their parents are unvaccinated. So it isn't as if the kids are doing a bad job and the adults are doing a great job of getting vaccinated. Now, it's true that now in Chester is doing great. If you're talking about senior citizens, 65 and above, the vaccination rate, I think is 70 or 80%.
I've heard that.
So this idea that somehow like, you know, Chester is a particularly anti-vax or negative community. No, Chester is an American city. American cities are suffering with this all over. You know, 70, 80% vaccination rates among the elderly who apparently have the wisdom of seeing that germs can kill you. And if like there's a vaccine for it, maybe go get it.
Yeah.
And as the younger the individual, the less likely they are to have gotten vaccinated. And so Chester is really just mirroring the trends we're seeing all across the United States. And in fact, we're doing as well as anybody, again, which means badly. The vaccine for kids, the Pfizer vaccine has been available since May. Most of us health providers, we've trained up and we've got all our little paperwork. So we've been giving the Pfizer vaccine to children 12 and up. We have not seen significant problems with other than the sore arms and the fatigue that all of us who get our vaccine, as our immune system kicks in, we get our immune system kind of, notices it's doing a lot of work and it kind of pulls that energy, and we feel that fatigue as our immune system is training. A lot better to train on fighting a germ than to be invaded and infected and to be in a 10 or 20 day battle for your life when you catch coronavirus. So unfortunately, the thing we as providers we didn't know we'd be battling is the internet. That's the thing, the force that we had no idea that we would be so susceptible to the difficulty of just explaining information and having just a what we call, what they call counterfactual, which means not true. So now, but when somebody is doing a counterfactual, you can't convince them. If I say I'm right and you say I'm wrong, I mean, if you believe I'm wrong, because it's about belief, right? We can't prove things that we believe. I don't believe in vaccines. I can't work with you. I'm just saying they're safe and effective.
Yeah.
I don't know.
It's
I don't
hard.
believe them. I use them. I utilize them because they are safe and they are effective. I also use, my pocket knife because it's safe and effective. I use my car because it's safe and effective. You gotta test the technology, see if it works, and then if it does, you gotta, some people somehow we became convinced that you notice. I have a BlackBerry. I don't trust that iPhone. I didn't like that Steve Jobs. I didn't like the way he wore his outfit. So that's why I ain't got no iPhone. I'm gonna stick with my BlackBerry. Well, you know what? Pfizer's been around a lot longer than BlackBerry company. So I kind of like how Pfizer has made vaccines in the past. I kind of like the way they've done their technology. I like Moderna too. I like the way they brought their technology to the front quickly. And some of the other vaccine companies, I don't like them as much. I don't like the way they run the company as well. And so, but the vaccines that they've made are also effective. Johnson & Johnson's vaccine is effective and it's safe enough. But I think it's important to understand the kids they have a vaccine that also is fully emergency authorized and is very close to full approval. With all full approval, you need the same amount of time for the regulators to come in and say, hey, is everything look above board? Does everything look good? Does everything look like it's working? And it is for these mRNA vaccines for kids. So we're really hoping the FDA, the CDC, they get their act together in terms of getting this approval for the younger kids, because the messaging, unfortunately, we as government, people who watch the government, we've been watching a hot mess. We've been watching a hot mess in our government of just back and forth and around and conversations and debates and arguments and every single thing. We're in the middle of this too, so it's hard to convince people when the team that understands the science sounds like they're confused. And
that's true. It's a lot of information out there. It's a lot to digest, just like you said, and you don't know what's real and what's not real. It's confusing, and you're already dealing with the trauma that you had to go through in terms of your experience with the healthcare system. And so it's a lot to navigate. And I'm hoping that through this conversation today that we can help people to get closer to being at a place where they can make a good decision, whatever that decision is for them, but that they can make an informed decision that's not tainted by the pain that they may have experienced through the healthcare system in the past. So I think you bring up so many good points. You just talked about the vaccines available for children. And I wanted to ask Dr. Messam, I know that the next group of children that should be able to get the vaccine is the 5 to 11-year-olds. Is that right?
That's correct. That's correct. Pfizer submitted their proposal to the FDA at the end of September. They should be reviewing everything and voting on it at the end of this month. I believe it's either the 25th or 26th.
Okay.
I expect that because of how everything is going wonderfully and science is working, that emergency use authorization will occur. And then once that occurs, that's by the end of the month, then we wait for the CDC, and they should be meeting on November the 2nd or 3rd, and a whole panel of experts go back and forth, arguing, and then they make a decision. But we think that based on the results that we're seeing with the vaccine so far, that there should be no issue with the authorization. And right now, the Pfizer vaccine is the only one up to this stage.
Okay. Thank you. Thank you for that update. So I know parents are concerned. I know that they have questions. And so as more information comes out, we're just encouraging people to speak to your pediatrician, speak to people that you trust, not relying on information that's on the internet, because it's too hard to discern what's real and what's not real. And we can have a whole different webinar on misinformation. It's a whole thing.
And school nurses have been sharing with my families that once the child has COVID, they no longer need to wear masks, and that they should approach their pediatricians to write a letter stating that the child should be exempt from wearing a mask. And I have explained to them at length that I cannot in good conscience do that. That this is one thing that we can do, one little easy thing we can do to mitigate the COVID risk. And so I have had a number of families leaving my practice because I absolutely think that it's inappropriate for me to write that kind of a letter. Vaccines work. These vaccines are safe for the millions of people who have gotten this vaccine. If there was any serious side effect, there would be people, collapsing all over. Some of what people are hearing is just literally not true. Mm-hmm. But again, people are confused.
Yeah. So again, we, encouraging people to speak to healthcare providers who you know and you trust to get your questions answered, because it's a lot of misinformation out there for sure. Dr. Walls, I know there's a number of reasons that Black people are hesitant. We talked about the reasons in healthcare, but can you tell us a little bit about why are, people in your practice, what are they telling you that they are hesitant? Why aren't they receiving the vaccine?
Yeah, I mean, there's a variety of reasons why people are not going to get the vaccine. And some we've already discussed, lack of information. And so there's also the lack of trust and the lack of the process. And so obviously there are historical reasons why Black people have not been able to trust the medical system. And so some people are going based on that history. Some people are fearful of side effects. They're saying that it has not been out long enough to truly see the long-term side effects, and they're not sure about the short-term side effects. And they hear things like the sweats and the chills and the pain in the arm, and that's leading them to all other types of conclusions. There's also fear of birth defects and deformities and so forth. So there's a lot of fear-based reasons. Obviously, as I mentioned, there's also past experience that people have had. I've talked with people who have been in the military, and they've talked about things that they've either seen or heard and been fearful of people being guinea pigs. There's been statements even around that anything that the government gives us for free can't be trusted, and they want to destroy Black people anyway. So this is just another way to do that. There's been fears about being microchipped. And people knowing what you're doing, the government being able to follow you. So there's been all types of fears. Like I said, lack of trust, lack of information. There's been myths, people not doing their due diligence with research, listening to other people and just going along hearsay. There's also the fact that people don't know what sources to trust. There's the lack of relationships with their primary care physicians, the lack of relationships with insurance companies and or reliable resources. So they don't know who to turn to. So many people are utilizing social media as their information source, but not understanding or knowing how to tease out the information. Many people are paying attention to the smaller statistical risks as opposed to the larger COVID facts. And so their focus is on that as well. So there's been a lot of different reasons. There's also people who are saying, look, my body is designed to do certain things. Let my body do what it's supposed to do. And so there's this belief in either a natural immunity or that it will build up the resistance. And then you have those people who say, look, I don't take the flu vaccine. I don't take pneumonia. So why in the world would I do this? And believe it or not, I've even heard things like, look, they haven't discovered a cure for cancer. They haven't discovered a cure for AIDS. Why in the world would I take this vaccine? It's not curing anything. It's not keeping people from getting it. And so why would I get it? And then why would I then turn around and get a booster shot? And then there's even some people who are saying they have religious and or spiritual reasons. They haven't felt compelled to get it. They haven't been divinely directed to get it. So there's all types of reasons why people are choosing and remaining hesitant in the process.
That was an exhaustive list. That was really good, Dr. Walls.
Okay.
I'm sorry that there's so many reasons, because it makes it so hard for the healthcare community and for educators to help move people into the direction of real information, because you can't just create a message and think that you're going to capture everyone's reason. There's too many. It's so many. It's so overwhelming. Yeah. But thank you for sharing that, because it helps us to think, what is the messaging and how do we communicate with people and how do we be more understanding and more empathetic, because just like Dr. King said, like, that's real to them. That is what they believe. And we have to start with that. We can't say, well, what you feel is not real, because that's what they feel. Exactly. But I'm glad that you brought up two things you brought up. You said that people don't have relationships with their doctors. And when I said that people should be speaking to their doctors, I neglected to realize, to acknowledge that everyone doesn't have a primary care doctor. And so you can't always talk to your primary care doctor and have those conversations. And so in those situations, I encourage people to go into the pharmacy. I'm a pharmacist, so I have to advocate for pharmacists. You can walk into any community pharmacy. It does not cost you anything. You can go to the back and ask to speak to a pharmacist and get your questions answered. Hopefully you know this person, you may not, but they'll still help you either way. So you don't have to schedule an appointment. You can even pick up the phone and call a pharmacy if you can't go in person. So there are other healthcare providers who are completely accessible if you don't have a pediatrician or if you don't have a primary care doctor. So please speak to healthcare providers to get your questions answered. One of the reasons that you brought up for people not being vaccinated is because they don't want to feel like they're being guinea pigs and they don't trust the medical community. That makes me think of the Tuskegee experiment. A lot of people have said that that was a reason that they decided not to become vaccinated. And so I want to play a news clip for you all. Let's see if I can navigate this and share my sound and do all this stuff. Let's see, give me 1 second. This is a story about a couple in Georgia. I think speaks to this Tuskegee experiment.
Medicaid and Peach Care for Kids members. Did you know? There are many free benefits only Amerigroup Community Care members.
Georgia couple dies from the coronavirus within hours of each other. Now, their loved ones in Hampton are begging anyone who will listen to get immunized.
Good Day's Alex Whitler has a story all new this morning.
High school sweethearts Martin and Trina Daniel never missed their kids' soccer games.
They went to all of their soccer games, attended every weekend, no matter where the soccer games were. We laughed about this a few days ago because they stayed at our house a few times during the soccer season.
The couple, who'd been married for 22 years and lived in Savannah, thought they'd come down with the common cold in July. They were taking over-the-counter medicine and drinking fluids.
Well, I got a call from his wife on the 6th at about 4:45 that evening. She told me that she said that Martin was being worked on by the EMTs and that he probably was gone.
That's Martin's brother, Homer Daniel. He says Trina sounded a tad out of breath on the phone, but family didn't expect another call saying she died too, hours after her husband and just days after staying home sick. Doctors say both died of the coronavirus at a time when the Delta variant started to surge.
If any way possible, you need to take that shot.
Loved ones say the Daniels weren't vaccinated.
Uncle Martin was a chemist. He went to Tuskegee. We went to Tuskegee. So a part of our hesitancy with being vaccinated is because we know what happened with the United States syphilis study. And so a lot of that impacted our decisions in doing that and us not wanting to be an experiment to see if it would work or if it wouldn't work. But I think with the issues that are surrounding this and how quickly people are dying, especially from the Delta variant, we are very happy that we did make the decision to be vaccinated, because I think our chances with being vaccinated versus not being vaccinated are very drastic.
The couple leaves behind two teenagers, Miles and Marina. Melanie Daniel and her husband are now their legal guardians, preparing to pay for Miles' college and Marina's extracurricular activities, all while juggling 3 young kids of their own.
It gives me something to look forward to and something to make their parents proud.
A family hoping others learn from their tragedy as they cling together for the kids' future. Alex Whitler for Good Day Atlanta.
So a story like that, and certainly they're not the only ones, is just so heartbreaking. It is so heartbreaking to know that parents won't be here for their children. I'm sorry, I'm getting feedback from this video. Parents won't be here for their children from a disease that has a vaccine. And so it's just so heartbreaking to me. And I'm hoping that this conversation that we have coming up will help move people into making the best decision that they can make for themselves and for their families, and help them to get through the hurt or the fears that they have from the healthcare system, so that they can make good health decisions. So I'm hoping we can get there. I want to ask Dr. James a question real quick. So we just looked at a couple that decided not to get vaccinated. They were college educated. He was a chemist, so he's a scientist. But their reason for not getting vaccinated is because of the Tuskegee experiment. And so I'm wondering, what has been the impact of the Tuskegee experiment and racism in medical care, et cetera, on people not wanting to get the vaccine? What's your take?
Yeah, I think the first thing is that we have to acknowledge that these things are true. I think for so many times when people of color, when Black folks say that there's been discrepancy in care or racism in the quality of care, sometimes the story is just not heard. It's just bypassed. It's just said like, you are making this up. And so we know from the Tuskegee experiment that that was true. It's been well documented. And what some people thought was for a good purpose of learning more of how to fight syphilis, but was not fully expressed to all the people that were in the experiment, who were getting treatment. And that's one of the things that has shifted, that people need to be aware, have given their consent, and be to acknowledge what is happening in a given moment, which is part of what we see with the vaccination process now, right? There is a lot of information that's there, even though, yes, we can always get misinformation. There is information about how the study was done, who was in the study, ages, demographics, and all this information that we can then learn and then decide to consent. But the other part of this is that we also know for even people of different ethnic backgrounds, I mean, there was studies that was done in Puerto Rico for Puerto Rican women where they thought something was happening to them to get treatment, but then the end result was that they were actually, at the end of it, were becoming sterile, right? So that there was misinformation. There's history there. We also know that just racism and bias in treatment, that a white male, studies have documented where a white male could go showing signs of a heart attack to a medical provider and be treated for signs of a heart attack, while a Black woman could have the same signs of a heart attack and be told, go home, you're being histrionic, you're being overwhelmed, you're imagining these symptoms that the person is actually saying. So there is truth and reality to racism and bias in medical care and treatment. At the same time, I think what we've noticed and what I've heard from everyone here is that when you don't get vaccinated, when you don't take this step to take care of yourself, it has also caused a discrepancy within our communities. Like families like what you just showed, where now their teenage children are not going to be with another family, which might be really hard or difficult for them to manage. And that things could have been different if they had decided to get the vaccine, and for them to maybe look at it. So I think and I know I'm biased because I did get vaccinated. So I understand that everyone has their own reason for why they do or don't do. For me, the thought is that, and my wife and I will say this, the government already has a way to track us. This is called a cell phone, right? It's called like Alexa. It's called all these other things, right? You know, that we are already tracked in so many different ways. The vaccine is not going to start or stop that. So I think there's some ways that if we pull back and look at all the different reasons why we say why, there's probably real other reasons that we can say yes to move forward. And at the end of the day, it is an extra measure that we can take to help us, that we've just seen over and over, case by case, that those who are vaccinated have had a better chance of fighting against COVID-19, or better or less symptoms than other people, and less ability to transfer it to other people. So I think like it is true that there is racism and bias and a history of that in medical care, and unfortunately still today. But there's also so much that we see that is showing that we can get the help and support that we need. And without getting the care, I've seen more communities of color be disadvantaged by not getting the vaccine and be impacted by not only COVID-19, the illness, but also the economical and other parts of what we've been experiencing.
Mm-hmm. That's so true. Thank you. Thank you. So I have a follow-up to that then. So what needs to happen? So how do we move toward healing and dealing with the emotions where people are afraid or they're scared or they're, taking experiences that they have had themselves and they don't trust? What happens next? How do we get through that? And that's and I also want to hear Dr. Wall's weigh in on that one too.
Yeah, I'll say that the thing I've been saying is that you got to first take care of yourself, right? Like you have to do what is important for you. And so once again, talking about my own family, where we got vaccinated, but then that then shows a model to our own children, and then to those around us, right? So those are the things that we can control. My hope is that sometimes the people we respect in the community, in our family, on TV, the more that we see them make steps to get vaccinated, that it can increase the chances that we might do it. The difficulty is that some of the people that we're looking up to are the people who are not getting vaccinated, especially within our community, and they're having all types of reasons that sometimes there's really a lot of holes in their reasons. And so if they don't want to get it, don't get it. But some of the things you're saying don't really match up. And so I think like that's some of the struggles there. So you can only take care of yourself, model to those around you, and then hopefully the people that you have influence over will start to follow your lead.
Going along with what Dr. James just said, and a couple others have mentioned, is the importance of listening. So first and foremost, we have to listen to what the people are saying. And many times when people are voicing their concerns for the first time, they're actually hearing what they're thinking out loud. And how many times have we heard what we're thinking out loud and it sounded better in our head and it made a whole lot of sense in our head, but then when we try to connect the dots after it comes out your mouth, it's like, wait a minute, I see that it's not matching up. So we have to give people the space to speak and then to see the linkage in their thoughts and then self-correct and or get that trusted information that can be inserted in the space to help them make the necessary decisions. So listening is first and foremost. And then, as you mentioned, validating. Right? If people are feeling fearful, if they're concerned, if they're nervous, if they're unsure, getting the vaccine causes a lot of emotions to rise up. And it also can cause conflict within families. I know within my own family, I was like, okay, if it's going to be for me, it's going to come quick and it's going to come easy. Like, it's not going to be an effort for me to get this vaccine. Whereas my husband was like, I'm not getting that. There's not enough research. It's not FDA approved and so forth and so on. And so, but because we have open communication, we're able to talk about it and make these decisions. But in some families, this may be a stressor and can cause additional conflict. So we have to be able to voice our concerns, our real concerns, and see whether or not there is validity to them. The feeling is valid, but the reason for the feeling may not be valid. And so we have to dissect that information. We also have to look at what fears are there and what anxieties are there. For instance, some people, and the doctors on the call can speak to it better than I can, are fearful of needles. And so it may not necessarily be so much about the vaccine as it may be about, why can't this be in a pill that I can just take so that I don't have to experience the anxiety of the needle. So that's also a discussion that has to happen. And then lastly, we also have to look at what would motivate you. Why would you get it? Are you a 1 out of 10, like there's no way in the world I'm getting it? Or are you a 3 out of 10? Well, there may be something that's motivating you that puts you more in alignment with saying, okay, I'll get the vaccine. And then let's discuss that. So is it vaccine resistance? Is it opposition? Or is it hesitancy? Or is it uncertainty? And so let's just take the time. Let's have the conversations.
I think that's a great framework that you've built to help patients to navigate through this very difficult time, to make this difficult decision. And I'm wondering from Drs. Messam, Hannum, or King, have you had conversations with your patients where they, said initially, or the patient's parents or the pediatricians, where they were hesitant initially because they didn't trust, because they had fears, but eventually came around? And maybe what did that look like? What changed for that family or parent?
So I'm happy I see the gamut. I see some people who are unsure and they come in and they trust me and they want to talk to me. And I sit and I talk with those. There's some of them who come in and they have read stuff on the internet and then they become the doctor and they're telling me stuff and so they don't want to hear. They don't want to listen. They're just telling me and they don't want to discuss it. But there are many patients who come in, parents who come in and say, I'm scared. Can you talk to me? And when I sit and I talk with them and I tell them I not only got 2, I got 3 shots and couldn't wait to get it. And I got a flu shot on top of that. Then they're more likely to listen. I also tell them I made sure that everyone in my family was vaccinated. So then I'm like, why would I put something safe in the people who are just so important to me? And so for those who trust me, they listen. I give my patients the gift of my time. Some of them just don't care.
Yes, I'd like to comment. And some of my patients who, initially were reluctant, were hesitant to get the COVID vaccines. Usually, unfortunately, there may be a bad outcome from the actual infection. Either a family member or a friend or somebody in the community that they look up to, may have gotten the infection without being vaccinated, and they may have had a bad outcome. And so there's a lot of heartache, a lot of grief in the community surrounding COVID-19 deaths, and that will often be the impetus for the patient to take a second look and have a more open mind about getting vaccinated. Another thing is the the punitive measures. If you want to travel to another country, if you want to go to certain venues like a concert or a museum or something, there may be restrictions. You may have to show a vaccine card, so-called vaccine passport, to participate in various social activities. So, that'll be another impetus. In some cities like New York City, for a time, they were actually paying people to get the vaccine, $100 or more per shot. That's another incentive. So, either through personal experience with someone that had a bad outcome from getting a COVID-19 infection, to various other restrictions that they're trying to overcome, that's leading to a change of heart for a lot of people regarding the vaccines.
Yeah, I think as doctors, we do feel the pressure of this pandemic. That there's never been in the history of the United States an illness that has been so threatening and so deadly to so many in so brief a time ever in the history of the United States. And all of the other preventable illnesses that we cope with year in, year out, suicide, accidental deaths from falls and fires and skiing and paragliding and being stung by bees and shark attacks and poisonings and homicide And domestic violence, all of it together has not equaled in a year what COVID has done, the destruction that COVID has wrought. As individuals, we are sometimes not aware of the magnitude of the storm we're in. And I often feel like a meteorologist, you know, and Katrina is approaching, and people are saying, you know, you guys are always saying this, the hurricane's gonna be so bad, or, you know, or you feel like the volcano person or the astronomer saying the asteroid is coming, you know, really. And we have to understand that as scientists, as people who, you know, have this background in science and in education, everybody knows that most scientists are big corny dummies, and everybody knows that most educated people are super annoying, and everybody knows that most doctors are kind of corny, not very nice people. And so why would you listen to them? We don't have the credibility as institutions to just say, hey, no, look, for real, you got to hear me. So we have to be able to reach people personally. You know, that's usually where we connect, is where we say, hey, no, look, I'm your doctor. I'm not a doctor. I'm your doctor. I'm just saying, you got to get this shot. I mean, I don't know a lot about everything, but I'm just saying this thing is killing people. So, you know, we have to acknowledge that when people are making their own decision, they are on the Titanic. We know it. We know the iceberg is hit. And we know that everybody who knows anything about the Titanic is on the lifeboats. The captain, the crew, all the first class patients, all the passengers who knew somebody from the captain or the crew. So we have to sometimes make people understand, hey, if you're so right about this vaccine is so bad, how come all the presidents got it? All the politicians got it? All the doctors got it? The nurses got it? All the people who have money got their shot first? How come everybody that knows doctors and nurses got it? So you got to ask yourself, like, who are you talking to? You might be on the Titanic. The problem is when you're on, you know, in the middle of not knowing, of being on the side of not knowing the kind of how something's happening, it seems like the big boat is safe. That somehow the Titanic is the safety. This is what I've always done. I've never needed another shot like this. Yeah, but this is new. So we have to be able to kind of put our credibility on the line as people who got that education. I mean, the struggles that my grandfather and them went through to get out of the Deep South and get their kids educated so then they could get me educated and get me, you know, to be in a position where I can work right down the hall from Tony Fauci and them. And then for me to not use everything in my power to explain what most people of color don't have access to, which is all of this firsthand information, you know, knowing, no, I'm not saying I think the Pfizer data looks good. I'm saying, I talked to Paul Offit and he's on the committee and he saw it firsthand and we've seen it, it looks good. And we want you to know what we know. We're just saying, don't listen to me about fashion, just about this. COVID's gonna kill you. Not in the vaccine, probably won't. You know, so we really have to, we can't accept when people won't listen, because it's another 100,000 Americans will die before this wave ends, and half of those could be our people. 50,000 more Black people could die in the rest of the year. That's apocalyptic. We don't normally lose 50,000 Black people from a preventable illness in 3 or 4 months. And that's after we've already lost 250,000. 250,000 of us, our own people, brown and black people, have died in this epidemic. We can't accept we don't accept that with homicide. We don't accept that with police shootings. We don't accept that with suicide. We can't accept that COVID can take us out because we know there's a preventable vaccine solution. So we have to, we are all tired of this pandemic. We are tired of convincing people of things we already know are factual scientific information. We're tired of having to confront patients who we thought understood us and trying to explain again. We're tired of Zoom. We can't be. This is like this is big as slavery. I mean, this is something that's hitting us and hitting us and hitting us. And we've gone through other epidemics and we've done the work. And so we have to just keep fighting on this. And the difference is normally we're fighting an external, foe. We're fighting Klansmen, or we're fighting, redlining, or we're fighting, in this case, we're fighting our own skepticism as people. We don't believe there could be, we live in a country where a bunch of scientists and nerds and rich people have done a bunch of work and we get access to it same as everybody else, where we can get on the lifeboat just like everybody else, where we deserve our shot. We believe somehow that 9/11 ain't for us. When we call 911, the ambulance ain't coming to help us. When we show up to the emergency room, we don't deserve the same help. They ain't gonna help us. That the police are not serving us. That somehow if we call them, that if we invest in an IRA, that money will not, we won't get our retirement back. We don't believe we deserve the access to this technology. That this technology was made by us and for us, Black people in America. We got it first because we got the best technology. We have access to it. I wish I could get some shots and take them to Sierra Leone. They're desperate to get these same shots we're refusing. I wish we could take them to Burundi. I wish we could take them to Guinea. I wish we can take them to Haiti. We're living in a nation where we have access to this privilege of getting this safe technology, but we're scared. We don't believe it's for us. So I think we have to convince each other that we deserve this safe, effective cure too.
We absolutely do. And I think you brought up a lot of great points. And one thing that you said had to do with listening. And that goes along with a thought that came up as Dr. James and Dr. Walls had discussed, how do we get through the healing process? And I'm wondering, can we, just as we expect healthcare providers to listen and to understand people's perspective and where they're coming from, can we ask patients who are still hesitant to listen? Can you hear what we're saying? Is that a viable option so that they at least just listen? You don't have to agree, but can you just listen to what I'm saying? That's kind of where I've started my patient education now. It's like, listen to me. And then they give me permission to talk and to share with them. Dr. Walls and Dr. James, what do you think? I know we're like 1 minute up here, but that was just a thought I wanted to share.
I'll hit the single, and then Dr. Walls will hit it out the park after. I just think about how we all have different thoughts and opinions, and like we've all been saying, we have to respect that. What I've found to be really interesting is when people who care about themselves and the vaccine and their families have boundaries, right? Like just being able to say, like, do you have a mask? Like, look, we're going to have a family gathering. I want you there, but you can't come unless X, Y, and Z. And now people might feel like, oh, you're just doing too much, or but no, if I believe in the vaccine, if I believe in wearing a mask, if I believe in all these things, then I also have to speak up and create a boundary, even if my auntie or my uncle or my niece or nephew or my sister or brother don't agree with it. That's where I am. And so it's okay to have a standard. It's okay to have a boundary. And it's okay to let people know this is where I am. And hopefully sometimes in those tough, tense moments, we can have a real conversation. And if we don't react and blow up at each other and call each other some names and just talk, maybe we can also listen and hear. You can hear why this is important to me, and I can hear maybe why you're a little bit resistant or don't want to do it. And hopefully in that dialogue, in that conversation, we can maybe get to a place where we're at least more willing to do what we need to do.
To that point, it's really because of a past history of hurt that has taken place in relationships. And this is an opportunity to build healing and healthy and helpful relationships. And so, unfortunately, like I said, we've had a history of people not listening and spending time trying to convince and persuade, as opposed to listening and discussing and sharing information and using the joint knowledge between all of us to come to a collective understanding. Because really, this is about social responsibility. This is about compassion. This is about consideration. All of these quote unquote soft skills that are very hard for people to do. This is about building empathy. And so if we take this opportunity to listen, to understand, to feedback, give each other feedback. This is what I heard you say. Is this what you meant? And give people a chance to clarify and change their thoughts instead of looking to confirm what someone has said and vilify what they've said. Because again, unfortunately, this particular issue has become a political issue instead of strictly a health issue. And so we have to take the time to allow people to move, in some cases, at a certain pace, right? To get the information. We know that people have different processing speeds. We also know that people have been stressed to the max. And physiologically, we know that when people are stressed, they have difficulty making crucial decisions, utilizing critical thinking. And so all of this system has to calm down so that they're able to actually hear what is going on and listen to the other person. Because if not, they're purely moving out of a fight, flight, freeze space. And therefore, they're not living as effectively as they can. And these are health choices, these are family choices, these are life choices. And so with that, obviously, we each have our own decisions to make, but we also need to take time to learn and make the best decisions for ourselves.
Hit it out the park, she did. Dr. James, you called that one. You called that. Well, thank you everyone for attending. Thank you panelists for your time, our sponsors, partners, and supporters. Thank you, thank you, thank you. This was a great discussion. I enjoyed it. I learned something. I feel like everyone disclosed their COVID vaccine status. So I'm just gonna say I'm fully vaccinated. I'm sorry, y'all see me pushing this child. But it took me a while to get there. I didn't get vaccinated until June because of concerns that I had, but so I get it. It's not an easy decision to make. It's a process. And so just to sum it up, we just need to listen to each other. Just listen to each other, have conversations, ask questions, and just do the best you can to make the best decision for you and your family. So with that, I will say good night. Thank you, everyone. Have a wonderful evening.